What's up, everyone? I'm Patrick again. I will be introducing our next topic and speaker. The next topic will be a new hip public community engaged design for better health and wellness. Your speaker will be Pamela Napier. She's a design educator, practitioner of design thinking, design research, and design facilitation. She also co-founded Collab Creative, a people-centered design company here in Indianapolis. So let's bring it in together for Pamela Napier, everybody.
Oh, that was nice. Thank you. Oh, and I can see myself too. That's great. Hi, everybody. I am so thrilled to be here. I was so thrilled when I was asked to speak at this year's Indie Design Week. So thank you so much for having me. So yeah, I'm an associate professor in the Visual Communication Design Department at Herron School of Art and Design at IUPUI. And I've been teaching a range of courses in the graduate and undergraduate curriculum for over 11 years now. So I'm here today to tell you a little bit about a collaborative project that I've been working on at Herron titled A New Hip Public. It uses a people-centered, community-engaged approach to design research, and the focus is on helping to promote better health and wellness for low-income Hoosiers. So a little bit of background in my teaching. So I teach people-centered design, right? So that is all about designing with people and not for people. So we focus, particularly in the graduate program, on design thinking, design research, and design leadership. So we're teaching creative problem-solving processes and skills that go along with those, developing, adapting, and employing design research methods, and then design leadership. So all about facilitating creative, collaborative problem-solving. So the work that I'm going to highlight today, it's Community Engaged Project. It was selected for the 2020 Bantz Community Fellowship, and I've been working on in partnership with my friend and colleague, Dr. David Craig, who is also a professor and chair of the Department of Religious Studies in the School of Liberal Arts. And so this is an annual honor, and it recognizes research and provides funding for community engaged scholars, and it supports the translation of their work with their community partners. So our project, A New Hip Public, is focusing on increasing community support for low-income Hoosiers who are eligible for the state's Healthy Indiana Plan, or HIP is the acronym. And so that's an insurance plan that expands Medicaid coverage. And so our goal for the project was for IUPUI faculty and students to work with not only HIP insurers, but also diverse congregational partners to help strengthen public interest in HIP and focus on a shared responsibility of supporting continuous health coverage just for better overall health and wellness. And so what we're aiming for with this project is to increase public awareness of HIP, to help more people get HIP and stay on HIP, and then also expands community and partnerships around interfaith cooperation on health. And so this actually builds on previous research that David and I completed together in 2019, which was a community engaged research study that really looked at listening to people, so both members and non-members, in trying to get HIP. And so the research team listened firsthand to users who could speak to the program's effectiveness in securing healthcare and promoting wellness for people living in health challenged neighborhoods. And so we worked closely in partnership with two inner city faith communities. So First Baptist Church North Indianapolis and Shepherd Community Center. And our team held several participatory design sessions in order to not only listen to HIP members' experiences, but also their solutions for strengthening the program overall. And a few of the key things that we heard was a focus on direct personal assistance and trusted relationships with community-facing organizations. And so those are their top reasons for their successful navigation of the HIP program. And so as a result, the study's findings and recommendations identified gaps and needs for HIP eligible people, but also helped us frame the next step in our research together. So our approach for this project is, people-centered. So not only are we looking at, enabling people to communicate their experience through a variety of ways in order to frame root or core problems and opportunities in order to create some kind of meaningful impact in their lives and the world around them. And then this visual down here below shows the Herron design process model that we use in the graduate program here at Herron. And so our project partners and our team overall, so our main design facilitation team was made up of two of our second year VCD MFA students. So we have Luis and Emreta, and their role was to facilitate a people-centered approach to gathering community input. And so not only did they design the process of engagement and the methods for gathering meaningful insights from the community, but they also ended up developing conceptual prototypes that would then be taken into developing HIP campaign materials, which I'll get to in a little bit. And so then our main main community partners, so like some of our key partners, one was the CIC, so the Center for Interfaith Cooperation. So they partner with diverse religious communities all across central Indiana. We worked with MedWise. So MedWise is one of 4 managed care entities, or MCEs, that have contracts with the state of Indiana to help manage health benefits for members of the HIP plan. And then Good to the Soul and the Monon Collaborative. So they were part of an online community called the Healthy Me Learning Community. And so this was a community where clergy and health advocates and community members could come together and share lessons and consider future collaborations in order to empower their neighbors and connect to resources for health. So those were some of our key partners. Our project timeline and process looks a little bit like this. So it was a combination of not only our second year graduate studio students, but also a junior level designing and context course that I taught in the spring. So all through fall, so from like August to December, our graduate students worked on planning, designing, and facilitating remote participatory sessions with our insurers and our congregational partners. We were completely online this semester, so nothing was done in person. Along those sessions, they were not only analyzing and synthesizing that data, but then they ended up developing some conceptual directions for campaign materials. So at the end of the semester, they had conceptual prototypes, they produced a research document, and then into spring, while they were finalizing the document and putting together a presentation that they were delivering to not only our community partners, but also other community members that might be interested in the work that they had done, our junior level team was starting to do some secondary research and understanding not only what a public health campaign might need to look like and what it might entail, but also like what is the Healthy Indiana plan? What does the context look like? So while they're doing research, the grad students are finishing up their work. They deliver their community presentation and they hand over all the materials to our junior students, who then start to develop campaign materials. So I have 2 different junior teams that are working on developing campaign materials, which we're calling the Get Hip campaign. So they're both taking these conceptual directions that the grad students developed and starting to create visual materials for those. So we're still at the tail end of the semester. We don't end for like another week. But so the students are working on developing their materials. Luis and Amrita are serving in a mentor feedback partner role. So they're looking at their work, they're giving them feedback. And then, into June, we're actually going to have a designer helping to work on and help finalize those materials. So within the graduate students process, we did a lot of work via Zoom. We worked a lot on Mural. So we use that as our online collaboration platform. And so there was a lot of planning that went into these remote sessions that they ran. So a lot of planning on the Mural board, understanding the context, planning the sessions, all the activities that would take place, what the engagement would look like. And then they held 3 different participatory sessions. So our first one was with MedWise. And you can see here some images of, not only them working in Zoom, but then also the mural board that they use. So with the MedWise session, the main focus was looking at how the folks from MedWise help bring people onto HIP Plus. So what does that process look like? How are people being engaged? What kind of communication do they use? And what do they do in terms of personal assistance? So our grad students developed a journey map that they took our MedWise participants through, and you can see all these different, colored virtual sticky notes here. Those are our MedWise participants, leaving their answers and comments in the board as we went through the session. And so after that session, we worked with the Healthy Me learning community. And so we had to change our platform a bit because this community, might not have been readily available to hop on a computer. So they might've been calling in on their phones. They might've been just working on their phones. And so rather than using Mural, we used Google Docs and Zoom. So we worked with this group in order to understand from their perspective, from a community perspective, how do they understand and support health and wellness for their low income neighbors? Why do they think it's important to help support their low income neighbors? And then also, how do they communicate supporting health and wellness within these communities? So not only how do they communicate it to each other, to their congregations, but also how do they communicate it to funders? How do they communicate about it to people in other congregations and even the broader public? And so then our third session was with the CIC, the Center for Interfaith Cooperation. And so in between the first 2 sessions, Luis and Amrita had to analyze and synthesize everything that they had collected and develop some conceptual directions. So some ideas for what a Get Hip campaign might entail. We utilized the expertise and perspective of the CIC members to then give feedback and evaluate what Luis and Amrita had developed so far. So a lot of the questions revolved around, what was making the messaging effective? What makes it engaging? How could they encourage HIP enrollment? How could they generate messages taken from the quotes that people had shared? how could they improve the channels that were suggested? So channels of communication like social media, like printed pieces. So they offered a lot of really great, insightful feedback on these directions that Luis and Amrata had been developing. And so this is just an example of, how they spaced out, which I'm going to get into the concepts in just a minute, but how they set up the concepts and then enabled people within the group on the mural board to then offer feedback and talk to them throughout. So there are three directions that they focused on. And so this was, synthesized after they had taken the feedback from the CIC session. So each concept, each direction had not only like a theme, but also a key idea, a more detailed description. They had quotes from people, things that they had said, and they had suggestions for communication channels. And so the three different concept directions was, one, empowering low-income Hoosiers. So this was all about empowering these folks in their abilities to care for their own health and wellness, right? The second concept was HIP plus simple and clear. So that was all about like, let's make this communication and language as simple and easy to understand as possible, while also using the power of visualization. And then collectively investing in health and wellness. So that had to do a lot with looking at the broader public and how can, people in the broader public take some responsibility and try and help, folks that need it. And so with our graduate students, their final deliverables ended up being a pretty hefty research document that outlines their process, their methods, and their insights gained from the research project. And then also a community presentation. So they delivered, a slide deck, and we did this presentation via Zoom. And so then our continued work. So right now, currently, our juniors are developing these visual conceptual directions. So here you can see some images of us working with our junior level class. They use multiple communication platforms, not just Zoom, but they used Google Jamboard. So here you can see one of the teams are starting to ideate around, empowering low-income Hoosiers and what might that look like. Here you can see feedback critique sessions that we would hold in Mural, where students could give each other feedback. And then here are a couple of brief, examples of where the students are headed. So they're starting to look at, poster series. They're looking at presentation slide decks. They're looking at very easily printable, editable tools that can be handed over to not only congregations, but also nonprofit organizations, other organizations within the Indianapolis community that can help get the word out and help people connect with others that are trying to get on HIP or that have questions about HIP. So here you can see it's like a fold up printable, handout, and they're also doing like a black and white version of it too, just to, keep it low cost. But I have other teams that are working on social media campaigns. They're working on like freebie giveaways, like little packets of things that have, HIP branding on it. So they're working in lots of different areas, but all with the eventual hope of, getting more people interested in and on this, Medicaid expansion, particularly for our low-income Hoosiers and those who need some help in achieving better health and wellness for everybody. So we're really excited to see where they end up. They have their final presentations on the 3rd. So we're excited to see where it's going to go. And I can't wait to see how it ends up. So that is in brief, a case study on this project work that we're doing that touches multiple organizations, people, stakeholders within the city. So it's very, very fruitful and very rewarding work. So thank you so much. I don't know if anyone has any questions.
Thanks so much for that talk. We have a question over here on our side. So how did the pandemic affect the approach you took to the research and engaging with the community?
Yeah, that's a great question. It impacted it greatly, right? Because normally even with the students, we would be in the studio together and we would be together every day in the same space and we would be using the space. We had to take into consideration a lot of different like technological and just other capabilities and availabilities of our community partners, right? We couldn't go to them, which is what we would normally do. We would go to where they are. So really trying to listen to what they were able to do and when they were able to do it and working around their schedules and their tech capabilities, right? So these are things that we would never have had to consider before if we had been in person, because we would go to their place of business or we would go to their neighborhood and we would use, tangible tools. So that was a huge change, I think, overall.
Yeah, absolutely. We have another question from in the chat. What are some insights you can share about collaborating in Miro for research with the general public who you have to kind of like onboard to what Miro is?
Yes. Yeah, that's a great question, because you do have to factor in the onboarding, right? Like you have to factor in, like, not only are they able to, access the software and have, a computer that can do it, but also teaching them the very basics, right? So I think some tips in that is plan for that onboarding, right? And have, just like a handful, 5 things that they would need to do. Click a Post-it, type on it, and move it, right? Like those are the basic functions of using Mural. And then also creating pre-designed templates that they can work within. So we created templates and spaces and, directions for them, and they can follow you, and you can take them through the board. So anything that you can pre-make and have set and locked, so that they can move freely is something that worked for us really well. That's a great question.
That's awesome. So I think we have like maybe a couple seconds. I'm curious about resources that the audience can potentially engage with or to follow your project as it moves forward. Is there anything like that?
That's great. Not quite yet. So we're moving into summer to see, who we can connect and partner with to actually produce and put these materials out into the world. And so when we have those, we will then be sharing them, through IUPUI outlets and then multiple other spaces. So I would say, follow Herron's output, right? Follow IUPUI's output, because that's the first place that I think anything would go that would announce like a rollout of these materials. So yeah.
Great. So what are you looking forward to next with this project?
Looking forward to not only seeing where the students land, like on their work and what they have, but then also being able to present it to our partners again and see, what do we do with it, right? Like we have some directions, we have some materials. What do they think is feasible? What can they use? Not only with our insurers. So, we have, we're connecting with Anthem, we're connecting with MedWise, but also, our close neighborhood community partners. What is it that we can give to them that will help them the most? And then we will move forward with that. So I'm looking forward to seeing what their feedback is going to be on that.
Awesome. We're looking forward to it too. I'll definitely be watching. I'm a big fan of Herron.
Thanks.
Awesome. Well, we are going to hand the stage over back to the normies. Oh, also, thank you.
Thank you so much.
Thank you. It was my pleasure.